similar symptoms may present with different conditions. And so if you just go for medicines because you think it is a condition that you were treated for previously, you might be having a different condition, and so your treatment may not be appropriate. The other reason is that of being easy access to medication. Easy access to medication, where you feel when you compare where the hospital is and where you can go to the Kantemba to get your medication, you feel like actually I can find it even in a shop. It's not even in the pharmacy, just in the shop. In some places you find they sell medicines. And so that easy access has made people to start treatment on their own without consulting any health profession. The other one is easy access of information. An example I can give today, we have got the digital platforms, the artificial intelligence, AI has come in, and so people feel like they can simply Google and push in the symptoms that they have, and quickly a diagnosis pops up, and they think, why should I waste time to go and pay consultation fee when I am able to actually discover what condition I have? To that, there is a problem, because also people have been made to start treatment on a wrong diagnosis based on what they got from the digital platforms. And the other issue is also where people think they are elite, they are educated. Okay, some of them might even be within the same health fraternity, where in a long period, if you had to ask them for 2 5 years that they have had to suffer from conditions, they have not sought for any professional advice, because they think they know it. Only when the condition worsens, that's when actually we discover to say, even if they were in the health profession, there are those interests. For instance, you are managing your child, you have got that some fears, you are feeling for your child, some things you cannot give, some things you can give. You are likely not to be very objective when it comes to treatment. So we can go on to mention many reasons that prompt people to commence self-treatment. But for now, we may end here. Now, what are some of the dangers you starting treatment on your own? What are some of the dangers? We have talked about few benefits. As a matter of fact, I want to say benefits might be less compared to the dangers, because conditions are wide in the way they present, and we might not master all the symptoms. And so self-medication may not benefit us, may benefit us to a little extent, but the larger part is that of the dangers. The first one is that you end up taking drugs that are inappropriate for your condition. You take medications that are inappropriate for your current condition. And when drugs are inappropriate for the condition that you have, it is just an equivalent to you wasting those drugs. You might have spent money, it means you would have wasted your resources. Meanwhile, the body that is going to be receiving that medication, that is to the second point now, will end up being subjected to unwanted drug effects. When we talk about unwanted drug effects, we are talking about side effects, adverse drug reactions, and the like, because the body will get these drugs and it will attend to these drugs, whilst the drugs also are affecting the body. There's what we call the effect of the body on the medications, and also the effect of the medications on the body. If we are to be professional, we are to talk about the pharmacokinetics and the pharmacodynamics. So whether you like it or not, because these are chemical entities, whether what you are taking for what you are taking them for is a wrong condition, the fact is they will still have an effect on your body. So causing unwanted side effects, adverse drug reactions, sometimes which may even be fatal on an innocent body, which if you had only waited to seek professional advice, you were supposed to have benefited from the drug treatment. But in this case, because you started on your own, you end up not benefiting from them, except you are going to suffer the side effects and the like. The third one is that of delaying the actual treatment that is supposed to actually be commenced, and subsequently leading to the worsening of your current condition. Because you would have delayed for 3 days expecting that you are going to see some change. As you are waiting for some change, which is not forthcoming, your disease condition is worsening. Where you were walking, you begin to fail to walk because now you are bedridden. We talk about malaria, for instance. Where you were eating, you're not able to eat and you would have vomited, you have lost some water, you would have lost some electrolytes. And all in all, you begin to hear of complicated, severe malaria. I've just given that as an example. And I want to tell you that some of these conditions that we have become so familiar with have ended up causing complications. Did you know that malaria left unattended to is one of the leading cause of deaths here in Africa? Did you also know that severe malaria can cause more complications, including renal failure? There are some people today who are receiving dialysis in the way of managing their renal condition as a complication that occurred because of the malaria that was not treated in good time. The malaria that could not respond to treatment, because at the time when it was presented, it was already what? It was already too late. So every time that you are taking medication and it's not the right medication for the condition that you currently have, you are delaying the commencement of the actual appropriate treatment that will be needed, and thus indirectly worsening the condition that you have. The other point is that the danger is you may end up actually wasting your resources on the wrong medication, so much so that when the appropriate medication will be prescribed, and probably, as we know in our setup, sometimes medications are not all available in our health institution, you might not have the money to go and buy those medications. At some point, you might have wasted the resources, and when you need the appropriate treatment you don't have, what does it lead to? It will lead you to now going to get some date from somewhere, because we understand that health is the greatest resource that we have. And most of us, we know that when we are sick, we quickly want to get back on our feet and continue running our errands. And when we are told to say you need this medication, no matter how expensive it is, we would rather source for money so that quickly we buy that medication, because we can salvage our life in a disease state before we can die. When we are dead, there's nothing that we can do in there. So you end up actually wasting the resources that will be needed at a point when the appropriate treatment may be needed to actually be commenced. When it comes to antimicrobial medications, I'm using antimicrobial to include all the germs. You know, germs are referred to as microorganisms. So when I say antimicrobial agents, I mean all the drugs that we use to actually target the microorganisms. It could be parasites, it could be bacteria, it could be fungal, it could be viruses, and all the different types of microorganisms that are there. You know, when it comes to the drugs that we use for such, today we have got a looming pandemic. This looming pandemic is what we refer to as the antimicrobial resistance. The medicines that we could use to treat the diseases previously are no longer as effective as they were yesterday. Suffice to say, we are losing a number of antibiotics, antiviral drugs, antiparasitic drugs at a faster rate than we are discovering them. And so we are likely to reach a point where the doctors will know what condition you have, but then they are handicapped because when they do what we call the susceptibility testing, knowing in advance which drug should be able to attend to this microorganism, the lab people are able to do those tests. They're able to tell you that this one is not able to work because the microorganism has shown resistance. This one can work, but to some extent only because there is intermediate resistance. Then this one, yes, it is the one that can work. This is where we are. Actually, when you read, you're going to find that a number of deaths have been caused due to antimicrobial resistance. So self-medication, because as you self-medicate, you might not even know the rightful dose that you are to take. You might not even know how long your treatment should be. You might not even know how many hours should pass before you can take another dose, and all those. You might not even know which drug can be used in combination with another drug, because there are also what we call interactions. There are some drugs that we cannot use together because they compete. The other one working more, then the other one being reduced in terms of its effectiveness. And instead of killing off or inhibiting the growth of that microorganism, it begins to thrive, and then one cannot have their disease condition treated. And this is something that we all need to participate in. We need to exercise what we call antimicrobial stewardship, safeguarding and protecting the antimicrobial agents that we have, the antibiotics, the antifungals. We have to protect them so that they continue to be effective. You know what happens when they stop being effective? It will call for higher drugs in the different groups of the same antibiotics, antifungal, antiparasitic drugs. And the higher the classes, I want to tell you that the more expensive. I use the word expensive in inverted commas. We don't use that in medicine. We usually call for what is appropriate even in the business or economic circles. They refer to it as being cost effective. So the more money we have to spend. And remember, I talked about side effects. The higher the class, sometimes the more side effect profile that some of these drugs have. So we, the human beings, are the same one who have ended up making our own health to be more expensive and to be more complicated because of us not taking extra care when it comes to the usage of medications. The other one is also causing unnecessary pain on the individuals when it comes to self-medication. I think all of you can agree. There are some of you who just believe that for medicine to work for you, it should be an injection. And so you have taken it even to the young ones, the children. No, can you try an injection because you have tried all this? We call that irrational drug use. It is not true that only injections can work. But when you are self-medicating with your conviction, you look for a nurse or you look for any person you think can inject and cause unnecessary pain on the child or on yourself in a condition where even oral drugs can work. Or sometimes you may not even need anything to take orally. You may not need anything to take through an injection. Or you may need probably, it's just a cream and your condition is treated. So you hear of children now beginning to dread drugs because the experience that they have had when it comes to treatment is that injection that you cause them to receive, and they receive the pain as an add-on because you were convinced that when it comes to quick treatment outcome, in terms of positive outcome, it should be an injection and not any other route. Okay, and overall, we have talked about all these dangers. The other danger and disadvantage is where we make health service provision by the authorities that be, in this case, the government, to be difficult. Because when we begin to hear that this drug is not effective anymore, at some point through WHO, a pronouncement will be made to say, instead of us using chloroquine, let's remove chloroquine from the market. Whether it is expired or not expired, it will be good for nothing but to be disposed. But look at it, you disposing money which has not yet expired, because a pronouncement has been made from up there to say this drug, we should no longer use it. What is it that I am to say as we get closer to the conclusion? When it comes to drug usage, I have already mentioned underdose and overdose are not good. Both are not good, because sometimes we can fault ourselves to say at least it is underdose, it is not overdose, so it's not going to cause toxicity. When it comes to drug use, both underdose, which we call subtherapeutic, the dose that is not able to give us what we are looking for, is not welcome. We don't want it. On the other extreme, overdose also, we don't want it, because doses are well measured to say if we are to give this dose at this particular time and in this frequency of dosing, that means how many times in a day, and for this particular period, how many days, how long it should be, that is enough. When you give overdose, you are simply calling more of toxicity on the user of medication. And in this case, when you talk about self-medication, we're talking about both you as an individual taking, or you actually asking your children to take medications which are not supposed to be taken. The other thing is the duration of treatment is very important. We need to know that when we self-medicate, sometimes we are just looking for the disappearance of the first symptom. When it disappears, even if we have just taken it for 1 day, and yet this drug is supposed to be taken for 5 days, you stop. And that is the same thing that causes what I've already mentioned, antimicrobial resistance, when you are dealing with those drugs that are supposed to target microorganisms. All in all, allow me to mention a few myths that make us actually to call for self-medication. I will just mention the common drugs. Let me start with flagyl, for instance, which is metronidazole. Metronidazole is not equal to diarrhea. No, because not every diarrhea is caused by a parasite like amoeba, Shigella, dysentery, or bacillary, and all those other microorganisms that we can talk about, the cholera, Vibrio, and all those. Sometimes you might have just attended a party, and because of a buffet or a buffet, whatever you may call it, you end up mixing so many foods, which when they go into your stomach, they ferment, and the body responds through what we call biophylaxis. The body getting rid of what it does not want, and so you begin to diarrhea, passing of loose stool frequently, at least maybe more than 3 times in a day. Now, you find that there might be no microorganism in you having that diarrhea. So when you go and start taking Flagyl, what microorganism are you targeting? Because there's no microorganism involved. The body is just getting rid of what it doesn't want. So allow it to get rid of what it doesn't want. All you need to do is just to enhance rehydration, replacement of the water and electrolytes. Okay? And I will speak to that replacement of water and electrolytes in the next myth. So when you find somebody with a sore being given Flagyl, you should not be surprised. And so we are demystifying that Flagyl is not always equal to diarrhea. Wait, take more of fluids, take more of lacto products. Sometimes you just need those to help replenish the normal flora. And when all the toxins have been removed, which came about because of the indigestion and the fermentation of the different foods that you took, then the diarrhea will stop on its own, unless it goes beyond 3 days. Then you may think, okay, here, let me now consult, maybe I'll need some antimicrobial agent. Speaking to replacement of electrolytes and water, the other myth is that ORS is not for children. ORS is not only for children, because sometimes people have been given ORS and then they say, why have you given me things for children? ORS is oral rehydration therapy. And the mainstay when it comes to treatment of diarrhea, it is simply to replace the lost water and electrolytes. So when it comes to diarrhea, both adults and children lose water and lose electrolytes. So don't refuse ORS. It is not meant for children only. It is meant for everyone. The next myth is that pen V is not meant for pain. V is not meant for pain. I'm putting these across so that you know why many times we have ended up taking wrong medications. So many people think the pen V, the word pain in pen V is PAIN. And so they think it is for pain, especially the old folks. They come and say, I need pen V. When you ask them, they're even telling you, I don't need all this course because I only need it for a few days. I use it for pain. No, the word pain in pen V is PEN. And even that word is simply like an abbreviation because the drug itself is a penicillin. Okay, it is a penicillin meant for germs, meant for bacteria. So it is not for pain. Wherever you have pain, don't take pen V because it is not meant for pain. It is meant for other conditions. Okay? Then the other myth is there are sometimes when people think I have been given this medication or I was given previously to take 4 times in a day. So I think I can take at once and I will be treated faster. That is a myth because remember, the drug has got an effect on the body and the body also has got an effect on the drug. So if you take a lot at once, the body, if the liver is not overpowered as one of detoxifying organs of the body, if it is not overpowered, it is going to work on that same drug and the larger part of that drug will be removed and you end up with the minimal doses that may not help you. On the other extreme, if the liver or the detoxifying organs of the body cannot work appropriately or effectively on that drug, you may end up intoxicating yourself and you may suffer the consequences of drugs and sometimes death may also occur. So it is good to stick to the right doses and right frequency of dosing. If it is to be taken that way, then let it be that it's because it is appropriate and you can take it that way. What about the treatment of sexually transmitted diseases? There is no one drug that can treat all the sexually transmitted diseases. So there is a myth also when people have not moved well, they want to say, let me take something to cleanse myself or to prevent myself. What are you protecting yourself from? Because you don't know what microorganism you have. There is no one drug that can treat all the STIs that exist. So when we reach here, we usually promote what we know is appropriate, the aspect of fidelity and maintaining good health around our case a person is found, it is appropriate to seek medical and treat all the different sexually transmitted diseases that are there. So even that issue, there are a lot of myths that I can go on to talk about. The other one is malaria treatment should not always come with an antibiotic. So in self-medication, we have, if an antibiotic was to be added to the malaria treatment, it should be one because there is another infection that may need to be attended to as the person is being treated for malaria. On the other end, if it is to do with potentiating the effect of the anti-malarial drugs that we know, then that antibiotic that is supposed to be picked, it should be an antibiotic which also has some anti-malarial effect, so that when they're used together with the other non-anti-malarial drugs, there's going to be what we call synergism, or the additive effect, adding on the effect of the other drug. So there is a myth that every treatment of malaria should come with an antibiotic. It is not true. We need to desist from that. Remember, we need to be champions of stewards, or stewards of antimicrobial agents. I think for now, we can end here. And as we end, let me start with the question that I earlier heard. Our sister asked where one may be told they don't have malaria and tests have been done, but according to them, they think they have got malaria, and so they treat themselves. Remember, I partially answered this question, that there are conditions that present with similar symptoms. Some of you can attest who have really been attacked by flus. You are coughing and you have got flu, where you think you're just going to take Piriton and the flu goes and it doesn't go. And then you begin to feel your joints, they are weak, the body malaise, the chest pain, and you are having fever and the headache, your appetite has been disturbed. According to you, that's what you think malaria is. So we need to give a benefit of doubt to the test. When the test has been done and there is no malaria, we need to start probing other things. What could be the issue? Is this person coughing? Is this person having any flu? What about the urine? Could they have maybe some urinary tract infection and all those? Let me isolate flu, for instance, so that you may appreciate where most of us have convinced ourselves that we have treated ourselves for malaria and we have gotten better, even when the hospital thought there was no malaria. Flu or colds, mostly they are caused by viruses. And viruses mostly are self-limiting. Self-limiting meaning if we are to do the needful by way of maybe avoiding very cold things, in terms of the cold water, the cold drinks, ice-chilled things, and then we improve on taking more of warm and hot drinks, covering ourselves with the jerseys, just to make sure that we hype our immunity, we take more of these vitamin C's and the like. Flus, just like many viral infections, of course, there are some which maybe in future we may discuss, which may need treatment, but a number of them may not even need treatment because they disappear on their own for as long as we work on mounting up one's immunity. And when you talk about self-limiting, we expect the flu and cold symptoms to disappear within 3 days. Most of the times when we take these drugs like Piriton, they are not going to target the virus. They just target our symptoms. You're at work, you're not comfortable of doing things like because you feel like it's embarrassing. So when you take any drug like an antihistamine, they're just going to suppress the secretions. They've got nothing to do with the virus. So within 3 days, if you do all these things that I've mentioned, you find that you just treat maybe a headache, you take some painkiller, you take, and then within 3 days, all your symptoms disappear. Now, when you convince yourself to say, I know how malaria attacks me, and you commence treatment, hear me rightly here. Most of the malaria treatments are also 3 days. I'll talk about Coartem. Coartem is also 3 days. So here is where it might be true that you don't have malaria. What you may have is maybe a flu or any other viral presentation, which is self-limiting, which is supposed to disappear on its own in 3 days. So when you start treatment, for instance, on Coartem, Coartem is supposed to be taken for 3 days. So there is a coincidence. You take Coartem for 3 days and you feel like symptoms have subsided and you have been cured. And I've mentioned already that even without any treatment, if it was a viral presentation, it also is likely to disappear after 3 days. So most of us have convinced ourselves that when we treated ourselves with Coartem, even when we were told that there was no malaria, we ended up being treated, not knowing that actually we did not treat ourselves. It was the body's own response that helped us to have our symptoms improve. And there was no malaria in there. But having said what I have said, there is also what we call clinical presentation of malaria. And we know malaria the way it is, it does not improve on its own, different from the flus. You cannot have malaria on Friday and without taking any medication on Tuesday, you're okay. You will be in hospital because malaria, every time that it is attacking the parasite, it's attacking our red blood cells, then it multiplies in there, then it causes the red blood cells to burst, and then they attack other nearby red blood cells. It continues to worsen, okay? And so there are times when even at the hospital, even at the clinics, you have been treated, or we can be treated with what we call clinical presentation of malaria, where tests have been done, they have probed everything, and there's nothing that they can find. The condition is worsening. They can base it on the symptom presentation, and you are treated as such. But when it comes to the guidelines, that should not be the majority of treatments. That should just be once, one after maybe in 10 cases. The rest of the cases should be proved to say they are indeed malaria. For now, I will call for more questions because I've just answered the first question, but you are free, my sister, to come through if at all you are still not clear for further clarification. If you are clear, you can still give us that feedback. Thank you very much.
Thank you very much, Elder. That was a wonderful lesson that we have received from you, my dog. Right, dear parents, we have come at the time when we can interact with our dog who's on the call on self-medication. Please, Sister Katongo is saying the answer is clear, like clear crystal. So thank you very much. It has been answered very well. Could there be any parent with a question on the topic that we have just had today? Maybe if you have a question, you can kindly raise your electronic hand, or you can send yes, please. Can we get some reactions, some questions? The presenters. Hello, I've seen people like grandmother. Yes, the Mulongo's family. I saw you unmuted your mic. You can come through, please. And Mr. Liungunumwa, your mic is also
Yes.
unmuted. Let me begin with Mr. Liungu. Please, you can come through.
Yes, good evening. Good evening, team.
Yes, sir.
Yes, I have a question. I think when the doctor was presenting, when he was presenting on, are you getting me?
Yes, sir, you are loud and clear.
Okay, yes. When he was presenting on, is it on STI, say that you cannot get one medication, self-medication maybe for STIs. There was some challenges on the network. Yeah, on the network, I think I didn't get much on what he said on some STI. I said they cannot just get just one particular medication. I don't know if he can highlight something on that one, if it is
Right,
possible.
thank you very much, Elder. As you were presenting on sexual transmitted diseases, the network was a bit, the waves were like not stable. So kindly, the request is maybe you can repeat that segment so that we can get clarity, and then we'll come to Mrs. Mulongo.
Thank you very much. So on that point, what has been noticed, and I was presenting, and I'm still presenting on that one because of the experience that I have seen. The desperation that comes is where people just come to say they want this drug, or they'll tell you they have been taking a certain drug because they thought they were exposed to STI. Either the symptoms are already presented, or the symptoms are not even presented, but then just because they have got fear. So we are presenting today to say there is no one drug that can be used, just one drug to cater for all the different STIs. Drugs are there, or the medicines are there to treat STIs, but you find that it's not one drug that can treat all the different, because even their presentations, they are different. There are others which will come as syphilis, the others will come like gonorrhea, and then attached to the same. Some of them might come also in the PIDs, they might come as through that route also. Not that when we talk about sexually transmitted diseases, it's not that people are promiscuous, because sometimes it can come through not because of them, but because of maybe their partner and the like. So what may be important is to carry out tests so that we are sure of what we are dealing with. And when it has not presented, it is not wise also to say, let me start this because I'm sure I have exposed myself. Now, exposed yourself to what? That is a question. Because you might find that as you take one medication, it might be medication that may not even work, even to what one may be exposed to, if it is true that indeed they have been exposed. Or maybe the patient might not even be exposed to anything at all. So all in all, we are saying we want to safeguard the medications that we have so that we may get more benefit than any other undesired effect. Sorry for that background noise because of the arrangement of where I am. I hope I've answered my good leader. Then I have seen from the Mlongos asking what is the best way of neutralizing medication in case of overdose. The first thing I'll mention is that, for instance, the different types of medications have got established antidotes, especially those that are very dangerous in the way of them causing disabilities, complications, and death. To find that there are specific antidotes, and these antidotes we may not have in our homes. And when it comes to that, we also need to appreciate that sharing information is the number one step when it comes to toxicity management. If you share it to somebody who may be in the health fraternity, it could be a doctor, it could be a pharmacist, they just simply understanding what we are dealing with. Okay, what drug did this person take? How old are they? How much did they take? Will help put us at ease whether we are dealing with something that is a crisis or not a crisis at all. Because some of the alarms that we have is just by way of we are supposed to take this medicine, 2 tablets 3 times a day. This person has taken maybe 8 at a go. Just because they have taken 8 at a go, and we are afraid. And in being afraid, we so much have anxiety, and that may make us to have different steps which may even be more injurious. So the first step, ask. That's why in different countries there's what we call toxicology centers. There are toxicologists who are just waiting for questions to be asked by the community, and then they guide. Then, whilst activated charcoal and milk may work, remember what I have mentioned, activated charcoal also and milk, they are not universal antidotes, because there are some medications that they may not be required to be used on. So the first thing is to quickly take note of what medication has been consumed. What are we dealing with? Is it poisoning? Is it the pesticides and all those? So that quickly we know what to do. But when it comes to pesticides, for instance, for those who don't even need to waste any minute, quickly get into the hospital, the chances of saving a person who has poisoned themselves are higher if they reach in the hospital earlier, so that quickly the antidote is given, they are monitored, so that they are okay. The more we delay, the more danger we have in terms of one dying or getting to have a disability from such a thing. So milk is not a universal. Activated charcoal is not a universal. They can help, yes, but we need to be very careful as to what is it that we are dealing with. Thank you very much.
Thank you so very much. The Mlongos, please, you can come through, then we come to Elder Elliot.
Okay.
Mlongo? Your mic is unmuted. However, we are unable to hear you.
Pastor, good evening.
Good evening. Thank you.
Okay. Though I've written the question in the chat box, maybe just to simplify it, I just wanted to find out from doctor. We normally have girls, our children, who may have reached the age of puberty, and most cases you find that your daughter may have menstrual cramps, and in most cases we tend to give them drugs like may be given stronger painkillers. I joined a little bit late, but I just wanted clarification. How do we help out with such? Are we not abusing the drugs? And the other question is, how are we supposed to help the girls that have got menstrual cramps? Because there's a doctor from Nigeria, not Nigeria, Kenya, Dr. Biete. He usually talks about this in form of endometritis. I'm sure doctor may know about those terminologies. So my question is, how do we help out these girls? Because in most cases as parents, we tend to use drugs like paracetamol, brufen. So we need guidance. How do we help girls who are having menstrual cramps? Thank you. That's my question.
Thank you for that question. Number one thing is for us to appreciate that there are two categories, if not three. There are those who go through the menses without any problem, and then there are those who go through them with the same problem that our sisters mentioned. They just are sick, and they can't even do anything. They are crying and all that. They feel like there's concerned about them. So the one thing to check first of all is, are we dealing with an individual whose menses are regular? Regular, I mean them knowing even the days when they expect these menses. Why do I say so? Over time, you should be able to know that when it's around that time, then we watch what they eat, we watch what they drink. We want to promote more of fluids there, we want to promote more of resting there, and also the calmness. We don't want to for them to be tensed up because the condition itself will cause all that. So just looking around that, you may read more on that one. Other things that can be done even when it comes to management. So when we know, it's very possible for us to plan, but it's a difficulty for those who have got days that change every month. But we can still find a way of how do we go around that, because at the point when it's about to start, even if it's occurring at different days, they themselves can know that I think I am almost starting. Again, things can be done around that. So the presentation is that of pain, which is spasmic. You know, spasmic, those grips, like kunyonga and pulling, and that is coming about because of the hormonal changes around that. We have more of hormones there. The others have come low. We're dealing with the estrogens, the progesterones, and the like. So you find that there is also evidence that shows that some have ended up benefiting from these drugs that may be used as contraceptives for a short period. Why do I mention this? We are mentioning this to also safeguard us as parents from committing some crimes. You just go through your daughter's handbag, unknowingly, they didn't tell you that they went to the hospital for their problem, and probably they ended up receiving the oral contraceptives as one way they may receive help according to the attending doctor. And then for you, when you just see that my child has become wayward, you beat them to an extent where maybe you even cause some injury, not just injury, disability. By the time they open up to you what happened, it is already too late. What other things would you talk about? Also, there is evidence that even those who have got this problem over and over, not that we should prescribe it for them, but as an assurance on us as we are managing them, because I'm now going to give management on the part of drugs, which is okay for me to give, because there's what we call negative health sensitization. Sometimes when we mention things in trying to help the community, we end up being the very ones to promote the misuse of medicine. But for conditions like this one, where we know that every month some of our beloved ones will be having these pains and the like, we can help so that we know what to get. So the other thing that I wanted to mention before I get to the medications that may be appropriate is that there is an assurance that we should have that from that tender age, them just getting into puberty, as they go on more years, it starts reducing. That's what is there as research. It has got that evidence. The pain starts reducing, and sometimes it ends at some point. Then for those where it may continue all the way through, there's also some evidence that when finally they have their first child, then that pain disappears and it goes like that. So as we are managing them, we need to be assured that it will stop at some point. If not stopping completely, the extent or severity will actually come down. So having mentioned some of those points, which are very important for us to appreciate, what else is it that we are to look at? So we are dealing with pain, number one. Then we are dealing with the spasms, the pulling effect and the like. So you don't need a very strong painkiller, but one amongst those that have come out to stand out, there's one painkiller which is referred to as mefenamic acid, because apart from attending to pain, somewhat it has got some effect on the hormonal system also. Mefenamic acid. Some of you may be advanced. You might have heard of Ponstan. You know, Ponstan is simply a brand name. I know some of us might be in business, so we understand this issue of brand names. Ponstan is very, very, very good. Apart from that, just paracetamol itself combined with an antispasmodic. This is where you see some people receiving some Buscopan and the like. I am mentioning this because I know that I am not really causing the negative sensitization, because that is maybe good self-medication, because no one can miss that this is it's very difficult to miss that this is pain associated with my menses, because over time people know themselves to say this is what I'm going through and the like. So sometimes you can use paracetamol that will come already combined with an antispasmodic. So maybe the names we might not mention them all, but when you get through the pharmacy, you may simply ask for paracetamol that is combined with an antispasmodic. That will help both to attend to the pain and also to stop the spasms. That is very important. But then, for how long can you use this one? That was the question, I think. You know that the menses differ in terms of the period. It starts from maybe 3 days up to 7 days. Others go up to the entire week. And so you may not need all throughout that period. You may find that maybe just for the first, the earlier days when one is going through that, maybe the first 2 days or up to most 3 days, then they stop. They keep the other medications for another time. That's what I can say. Thank you very much.
Thank you very much, Elder. Looking at time, let me get the hand of Mrs. Mlongo and the hand of Elder Elliot, and then we can close. Mrs. Mlongo, I'm seeing the network is kicking you in and out. Maybe we start with you, and then we bring to we come to Elder Elliot. The Mlongos, please. The Mlongos, can you hear me? All right. It seems the Mlongos are finding it hard. Elder Elliot? Oh, he has left equally. Elder Elliot?
Good evening, Pastor.
Good evening, thank you. Sorry, I was looking for your name.
Oh, yes, my gadget has gone off, so I'm using my sweetheart's gadget.
Hallelujah. Please, you can come through,
Amen.
Elder.
Yes, my pastor. Thank you so much, Dr. Luke, for this wonderful presentation. I think that helps us to understand the challenges that we cause to our own bodies through self-medication. The other self-medication that I've discovered that is so common, Dr. Luke, is where people get diagnosed by the hospital and they'll also be put on treatment. But then when they feel a little bit better, they don't finish the course. For instance, you've been given a 7-day course. On your 3rd day or 4th day, you feel better. You stop taking the medication. I wanted you to comment on that one. Thank you.
Elder, that question is dangerous.
Thank you very much, my good elder, and I want to thank you this platform that we can join together as my good family from Kabwe, the Nubes. Thank you very much, my leader. Very, very important question. This is where we go for treatment because of the symptom of the pain we have, and because our time we are committed to the hospital, and when we like it's no longer there, we stop. It is not very good. It's actually detrimental on our part, because when that condition comes back, it may even be more severe than it might have been earlier. And remember, I'm already talking about antimicrobial stewardship. The other one I will talk about away from antimicrobial stewardship, so we can appreciate. I think one of these days. Okay, so one of these days you see me talking more about issues of hypertension and how we are supposed to actually be adherent to the medications, because some of the complications that we are seeing and some of the deaths that we are seeing is because of the same question that our elder has asked. If you were to put on antihypertensive medication, some of you may attest who might be on these medications that they didn't just start this medication. They notice, okay, your BP is higher, but can you go and do this, do this, do this? And at a particular time when you went back without even taking medication, the BP was controlled. They simply mentioned, continue doing what you have done in this past week, continue doing what you have done in these two weeks, because your BP has been controlled. At a point where they decide to say, we need to put you on antihypertensive medication, because they have realized to say the body is now failing to control its own BP. And so the only way we can help this body, and as we help this body, we want to protect the kidneys, we want to protect the heart, we want to protect the brain from a stroke, and we want to protect the eyes, is to put this person on antihypertensive medication. And so at a point when, after you have taken it for 1 week and the BP settles down, it is normalized, it is not the body that has done that. It is the medication that you were given. So when you stop the medication, you are simply saying, high blood pressure, come back. I want you. I am enjoying you. And at a point when it comes, I'm giving that as an example, it is a silent killer. This is where you just feel people to say, no, we were together yesterday, in a long time we had never met. It's as if the man was just saying bye to me, because yesterday after talking, today is no more. Why? Because we stopped the medication at a time when we needed to actually continue if our blood pressure was to be maintained. And this principle applies to all the disease conditions. If you have been told it's 14 days, continue taking for 14 days. If you have been told it's 7 days, continue taking it for 7 days. If you have been told because of where we have reached, this is diabetes, because of where we have reached, this is hypertension, you are going to take this continuously. If you cope well, use is going to be your medication. I have seen people who have lived from 50 years when they were diagnosed with the high BP. They have taken their medication for 40 years. They have never suffered with any complication. And if you have lived for 40 years from the day when you are diagnosed with these conditions, chronic conditions from 50 years, that will be 90 years. At 90 years, I've heard people start praying like, God, I have lived enough. Can you take me? Compared to the other person who will think, I will not want to get used with this medication. They stop, and a year or two, they think everything has been controlled. By the time they get into 2.5 years, they are to be spared. If they are to be spared, they will end up being on a wheelchair. If not, they'll end up actually going and leaving the family behind. Very important question, and let's learn to abide by the instructions that we are given. Thank you very much, my pastor.
Thank you very much, my elder. Yeah, at least we have learned a lot. Maybe Sister Mrs. Mlongo, are you now in a position to unmute? Otherwise, time is not with us.
Thank you so much, Pastor. And I don't know, the network keeps dropping off, so it's dropping it out. My question was, in the case of children, they tend to be exposed to more bacterial and viral infections. How, and every time, I'll give an example of my own children. Every time that we go to the hospital, it's antibiotics. They'll tell you it's a bacterial infection. We don't know what bacteria, but it's bacterial infection, and it's always antibiotics, and which I think is not good on their young livers and kidneys, and I believe in the long run may affect. What are some of the remedies that we can start with at home? For example, for flus and coughs that we can do at home, which we are able to see that this is a flu and a cough, and manage the temperatures and the like. Then the second one was, I think you touched a bit of it on the issue of things like activated charcoal. Some of the health books tell us how to use those ones, but is there a prescription for local herbs, if I may call it that? Because most of the time you find someone has a running stomach, it's drink charcoal, but how much charcoal do you take for a running stomach? And do you actually take it also? Is it necessary to have it done? Or they tell you, no, my joint pains, take soursop. How much of soursop are you supposed to take? I think that's where the other issue is sitting, where we have traditional medicine or herbal medicine against conventional medicine, the prescription, because certain times you are told to take the green leaf medication without a full understanding of how much of it, because the conventional medicine you're told to take 2 tablets 3 times a day at these times. And what about the other? How do we combine the two? And is it okay to combine both herbal and conventional medicine for a particular condition? Thank you.
Thank you very much, Sister Mlongo. So I'll answer them in a combined manner. And I want to start by, first of all, appreciating that the first pharmacy that was given to mankind are the things that surround us, forest, all that. Why start with? I don't want to discard the herbal medications, because world over there's what is called TCAM. TCAM, that is traditional, complementary, and alternative medicine. In countries where they are advanced and they have put resources to research, like China, India, you're going to find Chinese traditional medicine. You're going to find Ayurvedic medicine, which is Indian traditional medicine. And in there, they even put other practices like the acupunctures, those they call them homeopathic medicine, the aspect of Tai Chi's and all those other things. You find that those are very useful. Even when it comes to our training, even in the conventional setup, I'll tell you, like from the farmer's perspective, there's what we call pharmacognos. That is a study where we look at the drug sources. Where are these drugs coming from? Are they coming from animals? Are they coming from plants? Are they coming from simply being synthetic, where we concoct them in the lab based on what is naturally existing? Or they are just going to be new drugs altogether? And we are taught these same plants that we are able to see in our setups. That is to say, they are very helpful. The only thing that I have seen is the extreme to which they are being marketed. And we have our pastor here, and I'll start with the principle that sometimes people who are marketing these have ended up even misrepresenting some religious groupings like our church, because they talk about them in a way that shows that without this medication, then you cannot use any other medicine. So they will make somebody be comfortable in a condition which is start deteriorating. By the time this person goes to the hospital discovers actually that all this time you have been battling with cervical cancer, and the medication that they were told that is going to work has failed to work, but they have spent a lot of money, which is wrong. I've heard of people marketing these good products of ours to say this product can actually treat 72 diseases. Sometimes I have failed to stay quiet and I just ask, can you just tell me 5 or 6 diseases out of the 72? They have failed to mention the 72 diseases. All in all, what is there is that when it comes to the conventional, they have been made a little bit complex and also saturated in terms of the micro or the milligrams. Let me say the concentration, where you may have paracetamol, for instance, and it is 500 milligrams. Why? It is able to attend to acute presentation of symptoms there, and then a patient stabilized, and then any other thing may follow. So let's not allow people to talk ill about both extremes of treatment, except each extreme of treatment has got its own place. You cannot substitute this treatment for a person who requires to be resuscitated in coma and said, don't give them anything, we are going to give them this. You end up killing a patient. And before I can finish the answer, because I was looking at it to be very important to set this background. Some people will tell you that herbs are not chemicals. So they are the safest because they are not chemicals. I've asked the person to say, what is a chemical? They have failed to answer. Now, here I'm talking to people who understand from our simple biology, water is H2O. Water, which is one of the safest things in the world, is a chemical because it contains hydrogen and the oxygen. And even when we are to take water in extreme, there is what we call water toxicity. You may fail to sleep. You may only be relieved maybe after diarrhea or after vomiting. That's when so for a person to go out in the buses and everywhere lying to people that there is no chemical. Remember where I started from, I mentioned that a drug is a chemical substance which when administered to the body will change the physiological activity of the body. There is nothing that we can take in our bodies which ends up treating us without having an alteration of the way our bodies are functioning. That is a total lie. So sometimes even when we call people to present and they are beginning to present like that, even in our churches, for me, only that we cannot do that because we are supposed to be each brother's keeper. Sometimes when people are presenting like that, we know that they have gone out of the extreme. The products they have, they are okay. I can mention the neem tree. I can mention the gingers of this world. I can mention the aloe veras of this world, the cinnamons, the peppers, and all the different types. That's where medications come from. So every medication should have its dose. Now I'm beginning to answer the question. There is no way you can say this one doesn't have a dose. It should have a dose. Because when you put it in the body, there are organs that will be tasked to start working on it. So if there is too much of it in the body, some people have gone to the hospitals with some kidney failure because they took some medication whose dose they cannot understand and the like. So we need to strive, even if it's herbal, to reach a point where you say we can take half a cup or a quarter, a cup, and a sizable cup. Obviously, the cup should also have a size. Or it should be 2 times a day, or it will be once a day. There should be nothing that should just take without a dose. It is not good. Okay. Then the other one, you find that when it comes to activated charcoal, different conditions may call for different ways of using it. You can, because charcoal is simply an adsorbent. Adsorbent. You know, we use 2 words. There is absorption and adsorption. Adsorption is where this chemical is the one that will be pulling off some toxins from where they are, pulling them out. If it's in the stomach, pulling them from maybe the bloodstream into the stomach. And when they get into the stomach, then they are gotten rid of what? The body. Or when those toxins go out, then the diarrhea that somebody would have been experiencing, it goes off just like that. And the same principle is what you are going to see for those who may use it when they are rushing the patient to the hospital who has been bitten by a snake. It is an adsorbent pulling. So you find that the usage and how to go about it would differ depending on the condition that you are dealing with. When it comes to the lactose, the milk, and all these, the fermented products of milk, all we need to know is when we are having diarrhea, diarrhea causes the normal flora to be removed from our bodies. Just like some strong antibiotics may cause some of these friendly antibiotics to be killed off, because the broad spectrum won't choose which ones to attack and which ones not to attack. And when one has got their normal flora wiped out, it means the balance of defense has been affected. So where do we get this? So the lactobacillus, some of the sources is this same Mavisi, and also the unflavored yogurts. But on the market also, you can go and ask for what we call pro or prebiotics, coming in solution form or capsule form. Also those will help. So others will come in powder, then you dissolve it. All those will help to replenish the normal flora that you need, so that you stop having the frequent presentation of diarrheas, and also in other extremes, the presentation of fungal, especially on our ladies folks. Then the last one is the one for children. How do we go about it? It is true that sometimes antibiotics may not be needed. Remember, even coughs, there are coughs that may come because of viruses, and so they might be self-limiting. So if we give an antibiotic, it's not true that we are treating it. And to this one, I will add another myth. Amoxicillin is not equals to cough. Remember those myths I talked about? I add another one. Amoxicillin is not always equal to cough, because some of the coughs will come because of the change of season, will come because of an allergy, they will come because of indeed just imagine you have painted your house and you are very sensitive to the paint. It is still fresh. You go to sleep in there, the following day you wake up, you're coughing. Where has the bacteria come from? From your paint. Where is the bacteria in the paint? But then when you go through to seek medical attention, sometimes also you end up receiving what you are not supposed to receive. We are not saying people are not professional. All of us here can attest that we have made mistakes. No one who can say from the time I started practicing my practice as a teacher, as an economist, as an accountant, I've never made mistakes. We all are humans and we are prone to make mistakes. And that's why we need to embrace what we call lifelong learning, continuous study to perfect our skills if we are to avoid this issue of making mistakes. What are some of the home remedies? I will isolate those which are common, we are familiar with. Garlic, which is Allium sativum. Onion, which is Allium cepa. They contain allicin in there, and they are antiviral, they are antifungal, they are antibacterial, and they also contain what we call anti-inflammatory properties. And then away from that, for those who may be having some cardiovascular conditions, they also help to counter thrombotic events, those clots and the like. So garlic, if we may make it to be part of our diet. I remember before I could even go to school, my late dad was using it in jam, either in jam or in honey. So he would chop those, and every morning a tablespoon. For every morning, for young ones, maybe a teaspoon, where from honey they get the benefit, which also helps to mask the taste of garlic or onion. Then they also get the actual benefit from there. You all can attest that when our children open schools, the coughs will be there the whole time. When they close, the coughs would have disappeared. It's because of this same mingling and the like. But if we can find something that may be like a diet or something that may be from the traditional aspect, which will be part of their daily routine food or drinks, then it would have helped them. The gingers have come on the market. Ginger, which is Zingiber officinale, that is very helpful also to help conditions like flus and coughs. And so we'll continue looking up to these things and see if at all we also can be blessed to come up with some products which we can start giving to say, for as long as children are taking this, then the entire term, they will not suffer from this. Otherwise, I've taken long on this question because I was trying to demystify the extremes, where me as a conventional practitioner, I think herbs are wrong. And then the herbalist also is thinking the conventional medicines are wrong. What is important is to balance up and also to make sure that we do the correct thing. I've gotten into a bus where people have been told this toothbrush comes with a toothpaste. You don't need toothpaste. A person comes with a bag full of things. By the time they disembark between Kawe and Kapiri, the bag is all finished. But the way they were marketing it, they were just marketing it based on lies. And they are safe for now because where we are, it's like in our territory here, Zambia, there is no law that governs their practice. We are looking forward to having a law enacted so that even that practice may be regulated because people may benefit from it. Thank you very much.
Thank you very much, Elder, for those good and brilliant answers that have come. Maybe just to add on what the Elder said, when you look at our books, especially us who have seen those books that some literature evangelists sell, maybe, for example, when you look at a book called Charcoal, when you get that book called Charcoal, you'll find the disease and the treatment, including the dosage, you'll find it there. If you go in a book called Healing Wonders of Plants, you get that book, you read it, they'll bring a plant, they'll show you which part of the plant is medicinal. Not all the plants are actually medicinal. Some, it's just the leaves, and they will tell you that the roots are actually harmful to your health. Maybe deworming. They will pick maybe a plant like banana. They will tell you that actually the whole plant, you can use the root for dewaming. The leaves, you can't use them for anything. So those, they also give you the dosage on how you should take and the time that you should do it. So our books are actually clear, elaborated on the dosage, so that we will not just sell you what you do not know the dosage. However, for those who are literature evangelists, we don't prescribe for people to say, no, what you can do is you can take 4 teaspoons of pure activated charcoal and then you stop diarrheaing. No, we'll give you the book and you read for yourself. If you find there's no dosage, please, it is not a health for you, as the elder has said. Elder, maybe you can give us your closing remarks and then you can close for us in prayer. Thank you very much for coming through, and
Pastor
thank you
Milton,
very much for the wisdom that you have
just
given
one.
us. Yes, please.
I'm sorry, I know we've
Yes,
run out of time, but I forgot
please.
just to ask. Yeah, I forgot to ask just one thing. Mothers, we are culprits. How long should we keep the medicine that remains from a dosage? Elder Biete, for example, paracetamol or metronidazole, how long should we keep? Because that's what prompts us to reuse, self-medicate. How long should we keep that kind of medicine? Once you open that 100 mils and you've given it for 3 days and it remains, how long should you keep it open?
Thank you very much. So the first thing is that medicines are in categories. You realize that there are those that you receive in powder form, and you are told to go and add water when you are about to use them. While form that they are when they come in contact with water. If the expiry shows that they are going to expire in 3 years' time, when they come in contact with water, there are these processes of hydrolysis and the like. They might not be used beyond 7 days because the degradation would have actually started. So if a child, for instance, was able to take and they finish their course because they are too young and maybe their course ended at half a bottle, that medicine needs not to be used again. It needs just to be discarded. In other countries, there is what we call the bring back or taking back of medication, sometimes maybe quarterly and all that, or there are specific points where you can even take the medication. So that's number one category of drug, that which comes with powder. It is not stable, and that's why on the shelf it will remain in powder form until when now the patient is about to use them. So when they are given, not more than 7 days. Then for these ones which come already formulated like paracetamol, you can use it for a lengthy period. But one thing that you just need to know is that, they are kept under a tight lid before they are opened. So when you open and you give them, they are also actually subject to contamination. And at some point, you may think you are giving medication, and yet you are the one introducing the microorganism, especially that they have in them some sugar because they are meant for children. So they are flavors and also sugar as a base that is added just to make sure that they are appealing to the children. So you can use them for some time, longer than the one that comes in powder form, but not for a prolonged period. So you don't have to wait for the expiry. At some point, you just need to discard. For instance, maybe after a month, going to month 2, just discard that medication. Then the other one is not every medicine is supposed to be kept in the fridge. Those that are supposed to be kept in the fridge, they are prescribed as such to say they will be kept at least between 4 degrees or maybe to 8 degrees, somewhere there, not to be frozen and all that. So the medicines that we keep in the fridge are not supposed to be kept there. That's why we are supposed to have a cupboard a little bit elevated away from children. Remember, every medicine is written to be kept out of the reach of children. The issue is if they are to be kept at room temperature, they should not be very close to maybe the window. You have put them on a glass pane. So when it is scorching hot outside, the heat, they are the ones absorbing. Or you need not to hide them in a suitcase that is way up in the roof. The house doesn't even have a ceiling. It only has the roofing sheets. So when the roofing sheets are hot, the first recipient of that heat is the medication. Even before the expiry of that medication, it might expire before the expiry date. So we need to strive to make sure that those that are meant to be kept at room temperature, at least below the 25 or 28 degrees, not in the fridge, but not above 25 degrees Celsius. But you know that sometimes it is difficult to maintain such temperatures in our homes where there are no air cons. That's why we don't need just to keep it for a long time. Thank you very much. Thank you, my pastor.
Thank you.
To give
Thank you very much,
closing
my elder. We are very grateful. Thank you very much for that beautiful lesson. I'm sure we are going to ask you to come again as soon as possible. You have not exhausted what you had prepared for us. I have seen that even my grandmother, Febi Mwanamonga, she's still on the call just listening, because, you know, when age is also catching up, she would like to prescribe for herself as a grandmother, but at least she has taken something that she will use for her old age. Elder, you can give us a closing remarks and then you pray for us. Thank you.